Hi there, I'm Dr. Lisa Peavy. For those of you who don't know me, I am an osteopathic family medicine physician, and I have been trying to put together somewhat regular, once a week, once every couple weeks, videos on all of the updates, new information, new studies, new data, new numbers, what's everything showing, where are we at with everything. The mandates have gone full steam ahead, beyond health systems, now businesses of more than 100 employees, and even other businesses of less than 100 employees are mandating that their employees start receiving this therapy. The thing that I speak at the most, and what I talk about as being the most concerning, of course, is regardless of how regardless of how effective it is, regardless of how good it is at preventing an illness or a severe illness, the fact of the matter is that it is also harming a large number of people and children now at this point. And it is, I believe, risk versus benefit for many age groups. It most definitely does not make sense. Okay. If you look at the numbers of reported deaths to the reporting system that we have, it is about 70 new deaths every single day. Our reporting system is receiving reports of about 70 new deaths a day. That is not just a few people. That is at least one person in every single state, sometimes two, for a lot of those states. So that's a lot of deaths. I in a group that I'm in, it's scientists, docs, practitioners, PhDs, etc. There's a lot of studies that go back and forth. People ask, of course, help with treating patients who come in, early therapy kind of treatment. They're not all in agreement that this therapy should not be available, should not be used. However, they are pretty much all in agreement that early therapy is absolutely essential, and they're all in agreement that it's being kept suppressed and that it's being kept hidden from people. And it's very disheartening to see time after time something else that comes out, and it just once again proves and shows that what we're doing is not only horrific, it's absolutely inhumane to have to ever force or to be forced to take an experimental, right, therapy. That this has not finished study completion. We have absolutely no idea what long-term studies, long-term effects from this are going to be. We 100% know that our pharmaceutical companies have not been, always on the up and up when it comes to putting out products that truly are safe, and putting out products that they aren't lying about potential side effects. I mean, we have many examples of that. One such example, of course, is the opioid epidemic. I mean, one of the largest lawsuits in history was settled 2009 against a pharmaceutical company who essentially made statements that were so incorrect. And their statements were essentially that there was very little, if any, addictive potential with these opioids. And so and also they started pushing, our vitals. Pain was considered a sixth vital. It wasn't just heart rate and your pulse and your respiratory rate. They were actually looking at your pain and counting that as a vital, and they were throwing opioids at it like crazy because that was the recommendation. And of course, what happens? Well, we have a massive, massive, massive epidemic in our country that includes addiction and all sorts of other problems that are associated with that. Deaths that have occurred, of course, you can go look up the stats in terms of how many opioid deaths happen every year. It's quite a few, way more than any any deaths from more natural substances, I guess. Even cannabis, it doesn't cause that, but yet they pushed these and created a huge problem. And that's just one example. Another example, recently, Chantix has been removed. It's been out on the market for at least 10 years, 10 to 12 years, I believe. I've used it. I have personally seen the horrific side effects associated with it in a number of patients that I've seen treated with it. Absolutely horrific side effects. It is not a benign medication, and it's caused a lot of horrible problems. And it's been out on the market for 12 years, and all of a sudden they're pulling it. So when we say that there's no long-term studies done on this therapy that is being mandated, that's exactly what I'm meaning. We don't have any knowledge of what's going to happen to people in 2 years, in 4 years, in 10 years, right? We really have no idea. Well, actually, I take that back. We do have a little bit of an idea because we did studies in the early 2000s on animals using the same proteins that are used in this current therapy. So those exact same proteins were used on animal studies trying to make a therapy for the SARS. And what happened is most of those animals, within about 2 years, because of the cytotoxic effects secondary to those proteins, most of the animals were dead. Now, we're aware of this. We look at neutralizing antibodies and things that can help with those cytotoxic effects, but we have a study out of Japan no, I'm sorry, this was out of China. I apologize. And there will be a link to all this information, by the way. But a study out of China showed that I think it was like 9 different proteins that they used, and 2 to 3 of them were over and over again shown to be cytotoxic to the body, and can become very problematic. So those were the actual proteins that we're using in the therapy itself. And of course, the concern is that over time, what happens is those proteins start to wear down the immune system. They become toxic to certain organ systems. And then over time, as they wear down the immune system, even simple illnesses, a simple virus, a simple cold is very difficult to treat because your immune system has been worn down so much. And so that's one of the major concerns that a lot of people have, that I have for people who've received this. We don't know if that's true or not. We don't know if that's 100% accurate. But what we are seeing currently is certainly people are coming down who are getting sick, who've received the therapy. There are people who are getting sick who haven't received the therapy, right? That's happening. But people are becoming sick. If you've gotten the therapy and it's supposed to be protective, you should not be getting this virus again. You shouldn't. You should have the protection. But again, we have waxing immunity, waxing effectiveness. Even the CDC, there's a chart that shows, really May, June, July, the dips in the effectiveness in terms of the therapy itself. So it's not effective, and we're trying to not trying, we are mandate it, force it on others, and coerce, manipulate people into taking it in order to save their jobs, to save their livelihoods, to essentially save their reputation. I mean, all sorts of things, right? I think the other thing that I really have a hard time with is when I hear comments from colleagues or from healthcare workers who work with these colleagues, or even they aren't necessarily just physicians, they're all sorts of staff, but physicians as well. But when we make the comment and when we start doing it, actually, because the hospital systems here are refusing to see anyone who has not received this therapy. They literally will not see you. That's probably one of the most devastating things that I've heard, in my entire medical career. I mean, we don't turn people around because we don't believe. We don't turn people away, because we don't believe in what they want in terms of medication. We don't do that. We don't turn the diabetic patient away who chooses not to take their diabetes medication, and they come in repeat offenders into the ER and DKA and, hyperglycemic or hypoglycemic, low blood sugar episodes. We see those people all the time, over and over and over again, and yet we continue to take care of them, even though they are a drain on the society. They are a drain a lot of times on us, on our ability to take care of other people when we have those individuals who come in. But we still care for them every single time. We still care for that patient who decides not to use protection and sleeps around with all sorts of people, and they get STDs all the time, and so we're having to treat those. We do that. We may not necessarily agree with the behavior, or the choice, I guess, is really what it comes down to. That's the choice that person makes. We may not believe in that choice, but we're still going to treat them. And I suspect that the reason why you try to say that it's okay to do is because those who haven't received the therapy can somehow pass it to other people. Please come and tell me how that works, because that does not work that way. I'm sorry, but what we're showing is that when the breakthrough infections happen in the patients who have had this therapy, their viral loads are actually way higher than even a typical new novel infection would cause viral load. So that actually points to the fact that those people who have received the therapy are more infectious than anyone who hasn't, just so we're clear, right? And also, a lot of people who haven't received the therapy have had the actual virus itself, and they have natural immunity. Natural immunity by far outweighs anything that we can get from that actual therapy itself. By far, we 100% want natural immunity. We are showing that natural immunity is more effective against these variants, whereas because of the 20% difference between variants, according to the director over at the 3-letter, C ends with a C, middle letter is D. That director said there's a 20% difference. That's why they're having the breakthrough infections. Well, guess what? The people who have natural immunity have better protection against those breakthrough infections. We want natural immunity. We are also showing that they have waning immunity over 5 to 6 months. We continue to keep that same immunity. So we actually want to catch this versus having to get the therapy and having the immunity start to dip down. And then after a while, they're going to do what? They're going to tell you to go get a booster, because at this point, they're not even approving a third dose, 18 and over, because they don't feel that it's going to be effective. They say that they have hope, but they don't have any proof. They have no idea. So again, people are going up risk versus benefit. They're gonna go based off of hope that this is effective versus all the potential side effects, the 70 new deaths a day, the 700,000 plus reported adverse effects to the reporting system. I mean, it makes much more sense not to get the booster, and so that you can be hopeful that it's going to be impactful and hopeful that it's going to be effective. This group that I'm in, one of the docs said that they had been seeing an increase in young, healthy men, okay? Young, healthy men, 20s, 30s, 40s, healthy, coming into their urgent care complaining of erectile dysfunction, meaning they're unable to get an erection. And this is very unusual. We typically see erectile dysfunction in people who are older, who have comorbid conditions, high blood pressure, diabetes, they're overweight, that sort of thing. That's when we tend to see more of the erectile dysfunction. We don't see it in young kids, but we're seeing it now. So what is that? The distribution study out of Japan that showed these proteins, these spike proteins, going and depositing in the testes and causing, and that can of course cause inflammation. I don't know exactly what is happening there, but most definitely that study pointed to a very big concern. And now what we're seeing is young, healthy men are coming in complaining of not being able to have an erection. So that is a huge concern for a number of different things. Fertility, of course, being one, which is something that I've very much been concerned about. And all of a sudden now we're starting to see more reports of that. Interestingly, when we talk about misinformation and manipulating how we gather information or how the information is listed as something, we look at the death certificates. So what happened last year is the death certificates, normally when we write cause of death, we don't, if the person came in with a heart attack, we don't write that as being the cause of death. What happens is, cardiac failure, secondary to an acute MI, an acute heart attack, right? So what happened last year is they started having anyone who died with a positive result, right? Anyone who died with a positive result, regardless of whether or not they died from the virus or whether or not they just died with it. Right? So for example, they were testing people who were completely asymptomatic. You'd have people who would come in for surgeries, for a gallbladder surgery, they'd test them, they'd have a positive result. So if someone comes in for congestive heart failure, they test them, they get a positive result. Instead of saying that they died because the congestive heart failure caused their heart to stop, or because the congestive heart failure caused fluid overload or something, they put number one as the virus itself. So there was an astronomical increase of what appeared to be, I don't know if it was astronomical, but there was an increase of what appeared to be deaths related to this virus itself. Well, interestingly, when you talk to funeral directors, they will tell you that last year there was actually, there was not an increase in deaths, there was a drop in deaths. And what they saw is they would see people who would come to see them who had been marked as having, this virus as having been what caused their death, when in reality, it really wasn't that. And he saw this over and over again. I'm actually going to post the link so that you can access it. It's I think an hour video, but you can listen to him. He talks about exactly what happens. I have then also spoken with someone who deals with birth certificates, and what she has told me is now happening, that she's seeing, is that instead of counting someone who has had the therapy and ended up hospitalized for the virus. So they had the therapy, then they caught the virus, and then they ended up hospitalized and they died. Now what they're doing, instead of listing it as being the virus as the number one cause, what they're doing is they're saying they died from blood clots, secondary to, cytotoxic injury, secondary to, maybe the virus. But so it's not listed as number one. So guess what? That that drops the number of deaths that you see in people who've received the therapy. Now, why are they doing this? Why am I having people tell me this? I'm not going out and asking these questions. We're just in conversation. We're having an appointment, and all of a sudden, there's like, oh yeah, and I'm seeing this. You guys, this stuff is happening all the time, everywhere. There is being data that is making it look like we're having more at certain times, less at certain times. You know, the ones who've received the therapy, let's make it look like it's less concerning. That is what my biggest concern is, that we are essentially misleading at such a huge rate, that so many people are running to this therapy and are having horrific reactions to it. And of course, the mandate. Again, how can we mandate 70 new deaths a day? Like, how does that make sense that we can say it's okay for us to have deaths from this? These are just the deaths. Again, we're not even looking at all of the adverse effects. We're having 70 deaths a day. How many more adverse effects does that include every single day from people who are getting these shots? Every single day. I mean, they've reported almost 1 million to the system in less than a year. 1,000% increase in injuries reported to the system. 1,000% increase. How can we mandate this, you guys? How can we mandate something that is obviously causing so many problems? And then we go and we look at our kiddos. We look at our kids and they're trying to mandate it to our children under the age of 12, or at least approving it, to kiddos under the age of 12. So we're looking at risk versus benefit again, right? Here's risk versus benefit. Children have like a 99.9999% chance of surviving this thing. It is not a disease for the healthy and the young. This is a disease for the older than 60 crowd and those who have comorbidities. That is who this is risky for. Children fly through this disease. If they had it, there were 300, little over 300 cases of deaths last year from kids. However, most of them were already immunocompromised or they had some other comorbid condition. Again, this is not an illness that affects the healthy. Okay, most children are pretty healthy. So 99.99% of them are going to fly through this illness, but yet we want to give this to them in order to develop herd immunity, right? That's what they say. But yet we have a massive increase of injuries. Boys themselves, there was a study, it was titled SARS-CoV-2 mRNA associated myocarditis in children. Boys were found to have an incidence of heart inflammation. Every one child out of every 6,000 or so boys will get myocarditis, according to this information. They have a 7 times higher chance of having gotten myocarditis than they do of being hospitalized for a CV-related hospital infection. 7 times higher chance, more likelihood of actually having heart inflammation that is going to impact them the rest of their lives. I mean, a lot of these kids, like some of them have gone back to activities, but there have been some who haven't. I know a girl who she's unable to play sports, like I think it was volleyball that she was doing. She is not able to do that. She is still short of breath. She still gets chest pain, and she has to go in for monthly visits to see her cardiologist now. And this is a girl. This isn't even a boy. So it's happening. Their risk of getting this long-term complication is so high. And yet we're trying to say that they need this for the sake of what? For the sake of our elderly and our comorbid people? Why are we putting our children at risk? I don't know why we would ever do that. they're safe from this, especially if they are on early treatment and they are taking the supplements and all the things that are needed. One of the studies found that about 80% of hospitalized patients are vitamin D deficient who have this virus. 80% of them are deficient. So that is a very simple, easy way of just making sure that your vitamin D level is within range. And that right there is going to be very helpful for keeping you out of the hospital. So there are so many things that you can do. We know the early treatment with some of these medications have been incredible. In fact, this is absolutely awesome. India is a country that has about 241 million people in it. It's about 2/3 the size of the US population. They have almost just under 6% of their population who has received this therapy. Under 6%. Okay, the US is at 54% approximately who has received the therapy. A couple days ago, India announced that they were 100% CV-19 free, meaning that they had absolutely, in all 33 states, they had no active cases whatsoever in a country that is only 5 to 6%. How in the heck is that possible? Well, what they started doing last year is they put out a massive campaign for IVM and early treatment. And so this prophylactic campaign, they put it out, and now they've literally wiped out this virus from their country altogether. Now, how absolutely incredible is that? Absolutely incredible. In addition to that, the WHO chief scientist, Dr. Soumya Swaminathan, they are suing her for murder because she put out, a huge statement that this medication that they're using for prophylaxis is dangerous and that people shouldn't use it. And so it dissuaded so many people from using it. There were a lot more deaths that they had from it. And so now they are actually suing her for murder because she put out a huge disinformation campaign about this medication that was absolutely incorrect. I mean, that is pretty telling. 2/3 the US population, no cases, compared to our country, and we're having massive cases all over the place. An ABC affiliate, I posted the article, but this ABC affiliate was like a fishing expedition or something, and the reporter thought he was being savvy and put out an ask to send in any stories of loved ones who had died from the virus who hadn't received the therapy. And in response to that, within like 3 or 4 hours, they had over 39,000 responses. And they were certainly not about family members who had passed from that hadn't received the therapy and then passed from the virus. It was the opposite. It was family members or themselves or people they knew that had serious adverse reactions, one after another, just kept listing. Horrific. You should go read them. They are very, very sad and very devastating to read. And they keep going. They just keep going, one after another. This mandate, this thing, it certainly is impacting a lot of people. I'm very fortunate in the fact that I don't work within a health system, so I don't have to make that decision. But my dad did. He is an OBGYN. He's worked in the same community since he graduated from his residency in 97. He's delivered over 50%, 60, 70% of those babies. He knows the town. He works 24/7. I mean, he is old town doc. If he's in town, he's on call, which is all the time. If he takes off, it's like a weekend, maybe an evening, but he gives so much back to his community. And he, just like myself, is weary. There's risk versus benefit. Does this make sense for him? He's been working in the hospital system for the last 18 months, among all sorts of people who've been positive. He's been great. We keep his immune system up. He does what he needs to in terms of his vitamin D level. I mean, we are very proactive about all of that. And one of the upper admins, some lady comes in and sits down. She was very rude, and she was coercive and forceful, and his job was on the line. His ability to take care of his family and his obligations were all of a sudden threatened, and he gave in. No one should ever have to take an experimental therapy ever in the name of science, ever, because we don't have the science yet. It is not available. We have absolutely no idea, and we are literally we're creating a massive problem with these injuries. And infertility is going to be an all-time high. I predict years of very few babies being born from this. It's already happening. There's almost 2,000 now reported miscarriages. So that's jumped up almost 1,000 since the last time I really talked about it, at least 5 or 6 weeks ago. So almost 1,000 more miscarriages have been reported. Now we're having the erectile dysfunction, and women are complaining about period problems and other things. I mean, we've got to wake up, and we need to start looking at this stuff. This is really important. It's really important. Please open your eyes, listen to your patients, start documenting. These injuries are happening fast and furious. And I will continue to update and give as much information as possible. I hope that it is helpful. I do have some exciting news. I am joining a program with Daniel Babinski. I'll post a link for that as well. Joining him and Ryan Cole, Dr. Ryan Cole. And there is another doc that is joining, Ursel, I believe. Maybe one other. But we're going to do a panel. We're going to talk at science. We're going to go through all the numbers. What are they showing? Let's talk about, the efficacy. Let's talk about potential injuries. Where is this going in terms of our country? What, the health systems? Are we going to be, are there so many of us, are we going to be forced to essentially open up our own sovereign businesses and completely, I guess, segregate from those who are refusing to treat and take care of those of us who haven't received the shot? I think it's very possible. So we're going to be talking potentially about all those different things. There's a variety of different options. It's on October 2nd. I will post the link again below, and it'll be on Bitreon live. So it will be a really big, awesome thing. And looking forward to talking more about all of this and really just trying to get more information out there for everybody. So I appreciate you watching today. Thank you so much. And have a wonderful day. Namaste.